So, do you also care for the tiniest of souls? But do you know about the IVH care bundle? Every preterm, especially less than 32 weeks, are at increased risk of intraventricular hemorrhage, and the reason being is because in the geminal matrix there is a cluster of blood vessels which are very fragile, which can rupture at any time, leading to intraventricular hemorrhage. 90% of the IVH happens in the initial 72 hours of life. Hence, we screen them in at day 0 and at day 3 of life. Can we avoid this by ensuring the IVH care bundle? So, what are the components of IVH care bundle? So, certain components are antenatal, perinatal, and postnatal. Let's talk about the antenatal components. Antenatal components includes antenatal steroids, magnesium sulfate, delivery in a tertiary care hospital. Perinatal components includes delayed cord clamping. So postnatal includes neuroprotective strategies. So what is that? Maintaining the head, neck, and torso in midline. That helps in the cerebral vascular drainage. We do not want the baby to be any other extreme side so that it leads to venous occlusion and can lead to IVH. Second is elevating the head end about 15 to 30 degree. The idea is again cerebral vascular drainage. So with gravity, if the baby is elevated by 15 to 30 degree, the cerebral venous drainage will be better and there'll be lesser chances of IVH. Second is minimum handling and giving stresses to the baby. So we would want to do minimum blood sampling in the initial few days of life, and we would want to give minimum stresses to the baby. That includes for position change, we want at least 2% technique. Two people helping with the position change in the baby. You avoid routine blood samplings. You avoid daily weight check. Then is cardiovascular stability. That involves rapid fluctuations in the blood pressures. We would not want that. We would want a stable blood pressure. The maximum risk of IVH is due to fluctuations in blood pressure. So we do not want rapid change in blood pressure. And also when you're putting a cannula or doing a central lines, always give slow boluses to the baby. Respiratory management for IVH care. We tolerate permissive hypercapnias in babies. So partial pressure of carbon dioxide of 65 mmHg during the initial 3 days and 75 mmHg after the 3 days is permissible, provided there is no respiratory acidosis. That means the pH of the blood is more than 7.1. We tolerate permissive hypercapnia in babies. We would want a normothermia that is 36.5 to 37.5.